Hello everyone. In this video, we will be discussing about the pharyngeal apparatus. So, pharyngeal apparatus outside to inside, we have clefts, arches, and pouches. Clefts are made up of ectoderm, arches are derived from mesoderm and neural crest, and pouches are from endoderm. How to remember cleft and arches and pouches? From outside to inside, we have cap. Then what are the derivatives of the cleft? The first cleft give rise to the external auditory meatus. The second to fourth obliterate by proliferation of second arch mesenchyme. Then pharyngeal arch cleft or sinus. If persistent cervical sinuses are there, then it presents as lateral neck mass anterior to sternocleidomastoid, but it does not move with the swallowing. Okay, so if the second to fourth cleft persist, then there will be sinuses over the neck anterior to sternocleidomastoid, but they will not be moving with the swallowing as it is visible with the thyroid swellings. Then next we have pharyngeal pouches. Pharyngeal pouches that were made up of endoderm, their derivatives. So first pharyngeal pouch will give rise to eustachian tube, middle ear cavity and mastoid ear cells. The anterior structures, okay, eustachian tube is the anterior part of the middle ear, then eustachian tube, after that middle ear cavity. From anterior to posterior we are going, and then mastoid ear cells. Related to ear, first arch. First cleft was external auditory meatus on the outside. Then second, number two. So two in number in our body are tonsils. Palatine tonsil epithelium is made by second pouch. Then third pouch. Third and fourth pouch both have ventral and dorsal wings. So ventral wing, third pouch give rise to thymus, and the dorsal wing give rise to inferior parathyroid. How we will remember inferior parathyroid? In the third, I is coming, so inferior parathyroid is from the third arch. Then 4. 4 is the superior number. Then the 3. So superior parathyroid will be originating from the dorsal wing, and from the ventral wing we will be having ultimopharyngeal body that will give rise to parafollicular C cells of the thyroid. So what are the derivatives? First arch eustachian tube, middle ear cavity, mastoid ear cells. Second arch 2 in number palatine tonsils. Third arch ventral wing thymus, dorsal wing inferior parathyroid. Fourth arch ventral wing ultimopharyngeal body and dorsal wing superior parathyroids. Then next we have arches that were in the center from the mesoderm and neural crest. What derivatives we have of that? So first arch nerve is mandibular nerve, that is third division of the fifth nerve, and the muscles are muscles of mastication that are masseter, temporalis, medial pterygoid, lateral pterygoid, and extra muscles. What are that? Mylohyoid, anterior belly of digastric, tensor tympani, and tensor villi palatini. Okay, mylohyoid, anterior belly of digastric, tensor tympani, that is in the middle ear. Okay, two muscles are there in the middle ear, tensor tympani and stapedius. Tensor tympani muscle is by the first arch, and tensor villi palatini. Then what are the cartilages? Maxillary process. Maxillary process will give rise to maxilla and zygomatic bone. Mandibular process will give rise to mandible and macal cartilage. And then malleus and incus, that is both the ossicles, first two ossicles of the middle ear are by the first arch. Then sphenomandibular ligament. Then we have second arch. Second looks like S. So second is for smile, seventh nerve and facial nerve. Then the muscles are muscles of facial expression. Then in the first it was mylohyoid, here it is stylohyoid. In the first arch it was anterior belly of digastric, here it is posterior belly of digastric. And tensor tympani in the first arch, here it is stapedius. So three muscles are analogous, means similarly we can remember by comparing both the arches. Stylohyoid, mylohyoid, posterior belly, anterior belly, stapedius and tensor tympani. And what extra muscle is there? The neck muscle, the platysma. Then from the second arch we have the Richard cartilage. Richard cartilage that will, in the first arch we have maxillary process, mandibular process. Here we have Richard cartilage and it gave rise to stapes. That is the third ossicle which was left. Malleus and incus was from first arch. Stapes is from second arch. Then what extra we have? Styloid process. Styloid process also from the second arch, and stylohyoid ligament. There it was phenomandibular ligament. Here it is stylohyoid ligament. And smaller or superior horn of hyoid bone. Smaller or superior. S, from S we have smaller or superior horn of hyoid bone. So stapes, styloid process, stylohyoid ligament, smaller superior horn of hyoid bone. That is from the second arch. Then, what are the syndromes or the diseases linked with the first and the second arch? Here is Pyrrhobin sequence that is linked with micrognathia, means small jaw, glossoptosis. The tongue will be falling, cleft palate, and airway obstruction. So, jaw is small, the tongue will be falling backwards, and airway obstruction and cleft palate. Then is Treacher-Collins syndrome. Treacher-Collins syndrome is autosomal dominant, zygomatic, and mandibular hypoplasia. Okay, here the cartilage is not well developed, and the mandible and the zygomatic that will be smaller, and hearing loss will be there, and airway compromise. So, what was there in the Pyrrhobin sequence? In the Pyrrhobin sequence, we had only jaw small and airway obstruction. But if hearing loss is also there, then it is Treacher-Collins syndrome. So, I'll remember we have hearing loss to teachers' words. So, Treacher-Collins is hearing loss. Then next we have third arch. In the third arch, again I is coming as we discussed in the pouch derivative. So I for inferior horn of hyoid is there, and inferior horn is greater horn. Superior was smaller, inferior is greater horn. Then what is the nerve of the third arch? Ninth nerve. First arch, the fifth nerve was there. Then second arch, it was seventh nerve. And the third arch, it is ninth nerve. And what is the muscle? Stylopharyngeus. Now we need to remember in the video related to vagus nerve, we have discussed that vagus nerve supplies all the pharyngeal muscles except tensor villi palatini and stylopharyngeus. So tensor villi palatini we have discussed in the first arch. Tensor villi palatini was there. Then in the third arch, stylopharyngeus. These two muscles are supplied by first and third arch respectively. Then fourth arch. Fourth arch nerve is superior laryngeal nerve. So fourth and sixth arch, these both are by the 10th nerve, that is vagus nerve. And further branches of the vagus nerve are superior laryngeal and recurrent laryngeal. Superior for the fourth and recurrent for the sixth. Then fourth arch give rise to most pharyngeal constrictors and cricothyroid and levator villi palatini. Tensor was in the first arch. Here is levator villi palatini and cricothyroid and pharyngeal constrictors, means all the pharyngeal muscles. And what are the cartilages? Epiglottis, thyroid, and epiglottis and thyroid cartilage that will take its origin from the fourth arch. Then we have sixth arch. Sixth arch is recurrent or inferior laryngeal nerve, and it supplies all the intrinsic muscle of the larynx. So all the intrinsic muscles will be originating from the sixth arch, except cricothyroid that was from the fourth arch. And what are the cartilages? Which cartilages are left beyond epiglottis? After epiglottis and thyroid, we have arytenoids, corniculate, cuneiform, and cricoid. Arytenoid, corniculate, cuneiform, and cricoid. A, C, C, C. Then next we have what is the development of the tongue. The anterior two-third will be developing from the first arch. Then the posterior one-third will be developing from the third and the fourth arch. Okay. Anterior two-third from the first and posterior one-third from the third and the fourth. So 1, 3, 4 is related to development of tongue. And fifth arch has no developmental derivatives. Then next we discuss aortic arches derivatives. Okay, aortic arches derivative. First arch will give rise to maxillary artery. So we will compare the nerves and the arteries. Okay, first arch was mandibular nerve, but the artery is maxillary artery, the maximal artery. That is branch of the external carotid. Then second arch, the seventh nerve was their facial nerve, and the artery here is stapedial or hyoid artery. Then third arch we had the common carotid. Third arch, for the third arch which nerve we had? Ninth nerve. And the third, C is third letter, so common carotid artery, and the proximal part of the internal carotid that will originate from the third aortic arch. Then fourth arch we had the superior laryngeal. And what is the artery? Left will give rise to aortic arch. On the left we have aorta, so left will give rise to aortic arch. On the right, the proximal part of the right subclavian. And sixth arch, the nerve was recurrent laryngeal nerve, and the artery on the left we have ductus arteriosus. Ductus arteriosus is something related to oxygenated blood. So oxygenated blood is always more on the left side. So on the left we have the ductus arteriosus, and right side we have proximal part of the pulmonary arteries. So what are the aortic arch derivative? First maxillary artery, second stapedial and hyoid artery, third common carotid and proximal of internal carotid. Then fourth we have aortic arch on the left, and on the right we have the right subclavian. Sixth arch on the left we have the ductus arteriosus, and on the right we have the proximal part of the pulmonary arteries. Now let's see images related to all this. See, here it is given. See, from this first brain will be developing and then the heart. From the first knob, the brain will be developing, and from the below knob, the heart will be developing. And in between, there are pharyngeal arches. Then here is limb bud. So here the diagram we need to understand. On the cranial part, the brain. Then in between there is heart, pharyngeal arches, and the limb buds. Then these are the diagram of pharyngeal clefts. See, pharyngeal clefts, ectodermal derivatives, second, third, and fourth incorporated in cervical sinuses. Then is pharyngeal pouches, and here derivatives are given, which we have already studied. And 1, 2, 3, 4, and 6. These arches will only remain, and that will be giving rise to the derivatives. Then this is the development of the aortic arches. So we studied first was stapedial, first was maxillary artery, second was stapedial and hyoid. So we are coming from upwards to downwards. So now we come downwards, then we come in the neck region. So what will be the arteries from the third arch? It is internal carotid and the common carotid. That will be from the third arch. Then we have the internal carotid, this internal carotid and the common carotid. Then we have the fourth arch, aortic arch on the left side and subclavian on the right side, the proximal part of the right subclavian. Then from the sixth arch we will be having the ductus arteriosus on the left side and proximal parts of the pulmonary arteries on the right side. So maxillary, stapedial and hyoid, common carotid and internal carotid, aortic arch and subclavian, and pulmonary and ductus arteriosus. This is how the aortic arches give rise. Then there is something called aberrant right subclavian artery. What happens in aberrant right subclavian artery? It is due to abnormal involution of the right fourth arch artery. Right fourth arch artery was supposed to give rise to right subclavian, but if it abnormally involutes, and also the proximal right dorsal aorta, this will also involute. Then and persistence of distal right aorta. Distal right aorta will persist. This will be giving rise to abnormal or aberrant right subclavian artery. It is an important abrasion developmental abnormality in the aortic arches, which we need to remember. It is common among the other abnormalities. So that is all we need to remember in respect to the pharyngeal apparatus. I hope it will be useful. If you find my content helpful, then please do subscribe my channel. Thank you.